Hi friends, I'm Dr. Zubin. Welcome back to my YouTube channel, Holistic Homeopathy, where we learn various homeopathic remedies and their indication. So we'll be continuing our series of learning various injury remedies of homeopathy, and today one of them is called Ruta graveolens. So let's begin. So Ruta graveolens common name is common rue. It belongs to the family called Rutaceae. Here you can see the image of the plant. And Ruta is mainly indicated for the injuries and bruising of the bones and periosteum. So following a fall or a blow, there is a sensation of bruisedness and soreness of the injured parts, and mainly for the injuries and bruising of wrist and ankle joints. There's a lot of straining of the tendons, especially the flexor tendons of these joints. So it's indicated for sprains. There's a lot of lameness. There's a weakness sensation after sprain of the joints. Also indicated for injury of the spine and limbs, which feels bruised again. There's a sensation as if the legs will give out, especially when rising from the chair. There's a lot of weakness sensation in the hips and thighs, just like other remedies like phosphorus and conam. Also indicated for contraction of fingers. There is a lot of pain and stiffness of wrist joint and the hands. Another indication for which Ruta can be given is for ganglions. Mainly, you can try applying locally the mother tincture of Ruta on the ganglion in 1:6 dilutions of water. Other indication for Ruta is sciatic pains, the pains in the back which extend down the hips and the thighs. And the sciatic pains are worse when lying down at night time. There's a sensation of shortness of hamstring muscles, just like graphitis. There's a soreness of tendons of the joints. Their pains are of aching in nature, especially of the tendon of the tendoachilles of ankle. The pain in thighs are worse from stretching of the limbs. There is also pain in the bones of feet and ankles. And along with this pain, the patient is very restless. There is more of a physical restlessness in Ruta, just like rust ox. So main indication is for ill effects of mechanical injuries, also for bad effects of injuries of the chest. So following injuries to the chest, the patient develops some infective illnesses like phthisis, that is tuberculosis of the lungs. You can think of Ruta. Other remedy for this indication is millefolium. Also indicated for injuries of the eyes, especially the orbits. Once again, as I told earlier, the injuries of the back and the spine, and injuries involving mainly the ligaments and the tendons of the wrist and the ankle joints. So due to this injury, there is a lot of straining of the muscles, and also due to overexertion of this tendons and ligaments, there is a pain and bruisedness of this joints. So mainly Ruta can be indicated even for the sports person, athletes who overstrain their tendons or ligaments or injure their tendons or ligaments while training or doing sporting activities. So modalities for Ruta pains or in general is the pains of Ruta are worse in the cold and wet weather, and like said earlier, the sciatic pain is worse on lying down. So when you study Ruta, you need to compare it with other injury remedies like arnica, rustox, phytolacca, symphytum, and ranunculus scleratus. So if you want to antidote the Ruta, if you feel you have overprescribed Ruta, you can give camphora for antidoting the Ruta effects. Complementary remedy to Ruta is Calcarea fos. So this is a short description of the remedy called Ruta graveolens. As I stated earlier, the injuries involving the ligaments and the tendons, mainly of the ankles and the wrist, think of Ruta. And these pains are worse in the cold and wet weather. And for sciatica pains, which is worse on lying down, mainly at the night time. So this is a short description of Ruta for injuries. Ruta can also be a constitutional remedy, but it's a very big picture. But this video is mainly for Ruta, mainly indicated for injuries. Hope you like this video. If you like this video, please do subscribe to my channel and share this video further. Thank you so much.